Michael Ochaya, a resident of Namwongo Parish, has 5 children. For him, malaria is more than just a disease. Almost every month, one of his children falls sick with malaria. This means additional expenditure on treatment out of their already struggling pockets.
For example, within 2 weeks, I've spent already 56,000 in 2 weeks. So in a month, the truth, in a month, you may cost more than 60,000.
While his household has mosquito nets, Ochaya says they offer little protection in his area due to stagnant water in poorly maintained drainage channels which serve as breeding grounds for mosquitoes.
I have mosquito net, but the time you are going to in the net, in the bed, you cannot go in the bed at 6. At time you sit outside the veranda. That's how the mosquito bite you there.
If you're at home, close the windows early. And these are messages we give, but it takes a while for them to sink in. Close the doors early. Make sure that the water around your house, remove stagnant water. Prevent breeding sites, basic hygiene.
Uganda remains one of the countries with the highest malaria burden globally. The country ranks 3rd in the world for malaria cases, contributing 5.2% of the global malaria burden. Every year, Uganda records about 12 million cases.
And looking at deaths, we are doing slightly better. We come in at number 10 globally and accounting for 2.5% of the deaths. When you count, that comes to just around 10,000 deaths, 10,000 deaths a year, which is still a very high figure.
Those who die out in the communities are not even mentioned, where even the myths are out there that it's witchcraft. Mayembe gamunywedemu omusaayi. But the jembe is just this small mosquito. And with the effect of no blood, we lose this person. And if it comes to the children below 5, the expectant mothers, it is so horrible.
In April of this year, Uganda rolled out a malaria vaccine targeting children. Health experts, however, caution that the vaccine is not a silver bullet and other preventive measures remain critical.
When the malaria vaccine came in, some people think it's a magic bullet. And some people are going to drop their guards and forget about other intervention. Uganda, we are blessed. We lie right on the equator. So all the conditions come together to favor malaria. They favor both the parasite and also the vector. So we have bushes, we have clear lakes, we have a lot of swamps.
Uganda recently experienced a reduction in support from the Global Fund, losing $30 million from a total of about $267 million in malaria funding.
The USAID, US government stopped on funding. They gave us a stop work order and they stopped funding several things under health. And up till now, it's not clear what they are going to fund, but it's a new day. Now, when that happens at the global level, the US government is also putting money into other pots, like the Global Fund. So for malaria in particular, we had a 30% cut from the Global Fund.
With this cut, some services had to be integrated, others scaled back. According to the Ministry of Health, the government is committed to closing the funding gap.
And that required that we go back and look at the resources that we have and reprioritize and say what is topmost important. Fortunately, guidance was given, and even within here in Uganda, we decided whatever is life-saving, that one we will prioritize.
Nobat Atkunda, NTV Weekend Edition.